the diagnosis of anencephaly is usually made in utero because we have the prenatal screening. And the ultrasound, which is normally ordered between 15 and 22 weeks, can diagnose anencephaly. And what happens is they call it the frog sign or the Mickey Mouse sign, and we will see the absence of the cranial tissue above the eyes. The picture that I have up here is of an MRI, and the MRI is known for imaging the brain. So I just wanted to offer this picture because you can see quite obviously you can even see the protruding eyes and the lack of the cranial tissue. And then another way to diagnose anencephaly is an elevated level of maternal alpha fetoprotein, and that's just a blood test, blood screening that the mother can have while she's pregnant. Okay, so outcomes. This disorder is fatal. So what happens is most of the time the fetus will die in the uterus, and my statistics from the Medical Task Force on Anencephaly estimate that 65% of the fetuses will die before birth. And then after birth, they normally die within the first few hours, the first few days, and death is actually usually caused by cardiorespiratory arrest. And then the same thing, the infant has no level of consciousness. They can't feel pain, they can't perceive stimuli. So because of this reason, because of the prognosis is so poor, it's fatal, many women will elect a termination of pregnancy. So what kind of care can we give this infant? Well, the infant, we're going to focus on palliative care. So we're going to try to keep the infant and the mother, the family, as comfortable as possible. We can focus on the quality of the pregnancy, the birth plan, which is very oftentimes important to the mother. Right after diagnosis, there's going to be a level of grieving. So we're going to have probably the mother's not going to believe the diagnosis. She's going to be upset. She's going to be angry. Probably the father as well. So what we need to do is assess the impact that the diagnosis has on the family. Provide them with honest information, accurate information. We need our opinions out of it, to state the facts. And then we just need to discuss what the family wants to do. If they want to terminate the pregnancy, or if they want to go ahead and have a birth. This picture shows an infant that was born, and he is anencephalic. You can see the protruding eyes, but I like this picture because they gave meaning to his child's life and to his family. They're dressing with a hat on, and he looks pretty comfortable there. So that's important to the family and to the mother. So bereavement care, we're gonna help them with the grieving process, and we need spiritual, cultural, religious needs met for that. So special cases, I just wanted to introduce organ donation quite quickly because organ donation may be something that the parents ask for. It can be possible if the infant is ventilated, he's kept on life support. But the problem with organ donation is that in legal terms, the infant is not technically brain dead. There's still a brainstem function. And if that brainstem function fails, oftentimes that is after the organs have failed. So the heart, the lungs, they have already failed. So organ donation may possibly be an option, but it's not a good outcome for that either. And so just in conclusion, neurological disorders, they can often be made early in the development, sometimes in utero, and then other times as soon as the baby's born. Because of the function of the nervous system, symptoms are highly varied, and management is required for a long time for the patient and the family. And then we have our references here and then on the next slide as well.